to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. And one of the ways about living a longer and healthier life is, staying healthy and having, skin that's healthy. But in the case that it's not, we have a very interesting and probably the most unique guest offering something in the medical community that I've brought on this show to date. So without further ado, I want to welcome from JAM Medical Consultants, Abdul Rahim Alhijaz, and if I got that wrong,
no, it's perfect.
Good. And Momina Karapetyan, pretty close.
Very close.
Thank you for joining me. Let's get right into it. So, this show, we talk about a lot of medical specialties. Like I was saying, have a lot of doctors and CEOs on the program, and of course, medical companies and breakthroughs. So, tell us a little bit about your medical specialty. And for the viewers and listeners, and explain it a little bit, because it's, like I said, it's very unique.
Absolutely. Well, actually, myself, I'm a pharmaceutical rep. I worked primarily in the pharmaceutical industry, small biotech, particularly here in Florida, and had the opportunity to come across this particular technology about 6 months ago. And the My Own Skin, like you said, is tremendous. It's revolutionizing the wound care industry. It's going to be something that the doctors are going to actually utilize for the patients. That's going to give them the opportunity to cut down on the healing time and to close wounds that they were not able to close previously. We've had cases where they were able to avoid amputation for certain, particularly in the diabetic patients. So we feel really, really great about it. Has some tremendous uses within the wound care industry.
Definitely. I know you're doing a lot of media lately, but, you've come on the right show. We talk to vascular surgeons on this show regularly, internal medicine, primary care. We talk about wound care about 50% of the time I'm on the air. And it's come a long way, but like you said, sometimes when there's rubbing or whatever happens to the bottom of a foot or different areas, it causes a wound, and the first thing that happens is get infected. And we've talked to podiatrists, like you said, vascular surgeons, and it's like a gateway to problems moving up through the system.
Absolutely.
So, Momina, tell us how this can help seniors and the baby boomer population.
So, babies and seniors, the good thing about it is that it can be used on both. It is your own skin. Nothing other than that. You are the first user and you're the last user of the skin. Whereas traditionally or currently they are using animal proteins, tilapia skin, and also partial thickness skin grafts, which means they take your skin off from an area that's large enough to cover up the wound, which causes, it's very painful. It causes a scar. And it's a surgical procedure. And then it's never really the same because, it's a surgeon doing it, and
he's got to match.
You have to take it from one part and cut it out and the other.
Matching up the margins, it's not easy at all.
And imagine doing that on a baby.
Oh, yeah. So babies all the way up. That's great. I didn't know that. And you made the best point there. I think you made we can use our own skin.
Yeah, so less
That
chance
just-
of rejection, diseases, you know what you have, bacterial infections, you know if you have one or you don't.
Yeah, and your skin's probably going to take better than transplant, right? Whether it's an
Yes,
animal
absolutely.
or
Yes,
another
absolutely.
human being.
Very little chance for any type of rejection because of the biologics that are coming from the same, from the donor as well as the patient, which Momina has addressed before that's autologous and that's
Autologous.
autologous. So that allows for it to be less rejection. Basically, the process is very simple. The doctor is basically going to take a small biopsy, typically from behind the patient's ear, but it could be in any portion of the body. But the most common is behind the ear, just to safeguard any type of future scarring that they would see. So they take a small, by the size of a pencil head, biopsy, along with 2 vials of the patient's blood, ship that off to our laboratory out in Arizona, and within 4 days, we grow within a 4-day period 3 4x4 sheets of the patient's own skin.
Wow.
So then it's used for the procedure, whatever the doctor has planned for them, and we ship it back overnight, and then the doctor apply it to the patient.
So it's 3 4x4 inches then?
Up to 3 4x4 inches, and it's replicable. So if you need more, we just take another piece of skin. Like we said, it's a very minimal amount of skin. It's painless. There's no operating room required for this. It's a very small in-office procedure.
Yes.
Even if it's done in the hospital. And it's easy, and it doesn't create additional scars, and 2 vials of blood.
Wow, that's unbelievable. I mean, this is such a great show, and having you on this evening, because I know I've listened to a few other shows you've been on, because I just want to learn so much more about this. And this hasn't even really launched. I mean, like later this month is the real launch, but
Yes.
you're here in South Florida talking about it now. And we've come a long way in South Florida in this region in medical breakthroughs in the last few years. So this is
Absolutely.
like another one right here.
Yes.
So thank you so much for coming on the show. I want
It's
to
our
ask
pleasure.
you. Yeah, definitely. I want to ask you also. We talk a little about wound care, but what other options are there available? Medical uses for skin. Like, could this be used hypothetically? If someone got a cut or something, or a pretty bad wound.
Absolutely. Yes, it can be used for other than just a specific wound. I mean, if any damage to the skin could be utilized in terms of, and it also depends on how old that particular scar or wound is. Then it can also be applied. And the moment it could speak to in terms of the
we use
length
it in
of time.
plastic surgery centers. Plastic surgeons use it on patients with mastectomies, which mean they have a breast removed, and then they usually have a scar extending from here to here, well, from their breast all the way up until their underarm to their arm. And that scar takes usually, if you're lucky, about 3 to 4 months to heal. And that's very painful, that particular scar underneath that arm area. And then, the women that do have that, they have to do exercises and all that, and it hurts. I know because I've seen my mom. She had died of breast cancer, and she had that. So we apply the My Own Skin. The My Own Skin, it helps to cut down the time quite significantly so that the scar can heal.
Second part of that question, isn't it better for your option here to be done pretty quickly? Like if the wound is fresh, or I don't know if that's the proper
yes, the
term.
fresher the better.
The fresher
Absolutely,
the better.
yes.
Yeah.
Mhm.
Okay, so this is something that people need to know. I'm going to give out the info a few different times tonight. I want people to get it. It's My Own Skin. It's www.csqbio.com. That's csqbio.com. 844-583-0951 is their number, and I'll give that out a few more times. So how can people get involved? Like, does the doctor have to call, or can friends, family members call, or does it need to stay into that kind of medical path?
Yes. It's actually best for the doctor to call. I mean, obviously, the patient can call and then refer back to the doctor, because once they call our center out there, they would know exactly how to direct them through. And then they reach back out to their particular physician, and then they will reach out to us, particularly for Florida patients, and we can make the arrangements for them to secure the forms and everything that they would need to order the to order the skin.
And even if doctors just want to get, they can sign up and fill out a registration form, and it's purely for educational purposes and questions. There's no strings attached. You don't have to order anything. but at least you're ready to go if you need it.
That's good to know. And I just thought of a few things I jotted down when we were talking. You talked about the breast cancer scar, and I'm thinking of, obviously, I was thinking scar cover-up, but what about tattoos? Some people want to get rid of tattoos. Is that going to be something down the line? Maybe some type of plastic surgeon may be able to remove part of it and then put something over the top of it?
That's a really good point that I didn't really,
I'm not speaking for me, but no, I'm just
because
saying
if they scrape that area deep enough, then yes, you can use a
well, yeah, that's what they do now, where they use laser, and it's said to be very
maybe
painful.
for that procedure, so it might be cost prohibitive for most doctors and patients.
This is more.
It's more medical.
Medical, and then cosmetic from surgeries caused. Like breast cancer, maybe
burns.
Burns. Perfect example. Wow, this is really a breakthrough. Now, I want to ask you. I got a couple more minutes till the break. A little bit about your background and how you got into this. Ladies first.
Oh, thank you. So I am a registered pharmacist. I also do clinical thermography. We have an office in Delray Beach. I work for Pharmco Pharmacy, and I'm also with Gem Medical Consultants. So my partner and I, Abdul Rahim, we basically are looking to educate doctors with the best tools out there for preventative and natural state-of-the-art treatments.
That's great. Wow. And that's right here, you guys are right here in Delray Beach.
Yep.
Wow. And Rahim?
Yeah, actually, my background is in pharmaceutical sales for like the last 7 years. We actually were a part of another platform called Every Ancillary. And our goal, myself, Momina, and our other partner, Talib, was to engage doctors and help them improve outcomes for their patient and also to improve revenue streams to their practices. So we specialize in ancillary services. And one of the ancillary services that we happened to go out and vet was the amniotic fluid, which is also utilized with the My Own Skin. But when we went out to vet the amniotic fluid, we got introduced to My Own Skin, and it completely blew us away, too. I mean, we had 2 doctors with us, 2 pharmacists, myself, and again, we were really impressed.
Yeah, most definitely. And Momina, second part of that, now the amniotic fluid, you said before, it helps to make
the amniotic fluid. It first thing it does is decrease the pain and the inflammation. They use amniotic fluid in hospitals quite a lot. The podiatrists love that for wound care, and our My Own Skin comes with that. My Own Skin, sorry, the fluid comes with the My Own Skin. So what it does, it decreases the pain and inflammation. It starts to break down any scar or fibrous tissue that had built up around that area. And most importantly, it increases what we call angiogenesis, which is new blood vessel formation. Because, a lot of diabetics, so huge diabetics, we have a lot of vets.
It's on the rise, yeah.
And, diabetes is like very, very common. And what it does, it starts to increase that circulation and blood flow to the area so that the wound is able to heal, and then it starts to repair and regenerate the tissue.
Wow, great info. We're going to take a quick break. Again, it's csqbio.com, 844-583-0951. We're talking to My Own Skin, and I'm going to regroup. I have so many more questions for you on the other side on the Living a Longer and Healthier Life show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the Living a Longer and Healthier Life show. And one of those ways is, great skincare. And if you don't have it, it can be developed from your own skin. And that's what we're talking about today on My Own Skin. I didn't mean to cut you off there, Momina, but we talked about different types of medical uses and different types of area on the body, age range of patients. I thought that was amazing. Babies all the way up to,
Yes.
people are living in we have doctors all the time.
Absolutely.
I say, doctor, what age range of patients do you treat? Well, I don't do peds, but I do 18, and I have a patient walked out of the office the other day, it was 106.
Wow.
And I'm just like, that's like a normal occurrence on this show, so that's great. You all age range of patients. We talked about insurance. We talked about the doctors. Is a referral needed from the doctor, too? They kind of got to get their hands involved in...
No, so I think most of the, particularly like plastic surgeons, podiatrists, they already have the proper coding, which, as you alluded to, would be the proper CPT codes, which they're already using when they use the patient's partial skin grafts. So the My Own Skin falls right under the CPT codes. So the procedure is FDA covered in that respect.
Well, thanks for mentioning that about the codes, because that's a big thing that, that's going to be a question that's going to be asked, because everything's coded nowadays more than ever.
Yes.
And in 2020, we're gonna come out with our own codes, which that will increase the price of the My Own Skin.
Mm-hmm.
So right now, at 4x4 inches is $3,000, and then if you get two 4x4 inches, it's $4,000, and then three of them are $5,000, which is fairly inexpensive compared to what you have out there.
Okay, and you said it can possibly be covered by insurance. It's up to the...
So it's covered part of a procedure. So basically, doctors get like a big lump sum, and then they decide what they're going to be using in that.
I see.
Yeah, in that arena.
If it's not used right then and there, can it be saved, or is it's tough to...
Yeah, no, you can't.
It needs to be used in a quick... Wow, I'm just amazed about the turnaround time that you were talking about.
Yeah.
I mean, it can be within the same week.
Yes,
right?
absolutely.
And we're looking for facilities. The manufacturer, which is BioLab Sciences, they're looking to incorporate facilities next to the wound care centers, and
Okay.
trauma centers in
Yeah.
different states.
So
So
the
it can be right there.
Yeah, that's genius. The procedure is going to be done at a center, one of those centers.
Yes, the procedure's good. They're just looking logistically to get closer to some of the more active burn units and facilities where more wounds are actually treated, so that way it can cut down on they can actually reduce the time to get it could be less than the 4 days in terms of the turnaround.
I know I asked a little bit about your background, and you had mentioned a little bit about how you came across this. You're in the pharmacy field, but this you must have just been amazed, when you first found out.
Yeah, I mean, we were out in Arizona viewing the amniotic fluid, and while we were there, they introduced us to the My Own Skin, and they brought us into their facility. We had a chance to meet some of the original creators of the particular My Own Skin. So it was a heck of an experience for us, and we feel really excited about bringing it here to Florida and sharing it with the medical population here.
Yeah, that's great. So it's here in Florida, South Florida, and nationally as well.
Yes, absolutely. All 50 states.
Oh,
Yes.
And
That's
outside
great.
of the country as well.
Great. And you FDA approved for the procedure, correct? Did I get that
Yes.
right?
Yes, that's
Okay.
correct.
Good.
Yeah, absolutely.
I just want to make the one other thing I want to get to. I know we're still good on time. We have a few more minutes, 5 minutes. So some of the research in this, obviously a lot of the research to get FDA approved was done years ago.
Yes.
I know you elaborated about that a little bit before, but where was it done, and how did it get the FDA approval? Because sometimes it's tough to get FDA approval, especially if stuff, in this country or out of this country too,
Yes.
coming back in.
Well, the actual My Own Skin is FDA cleared, and is FDA cleared under what they call minimum manipulated FDA 361. Then from there, it falls under the umbrella of what's already FDA approved in terms of the procedure. The procedures have been approved for 15, 20 years. So it's just this particular component, which would be the My Own Skin, is now FDA cleared to be utilized and allocated toward the CPT codes. So most of the facilities, such as your surgery centers, your trauma centers, the hospitals, they're very familiar with the CPT code process already, and they're already approved for it already.
Yeah, and I've heard it can be tough. So you've already went through that whole process, the government insight, looking into everything, and,
Yes.
and so that's already done, and it's here now. Second part of that question, this research and development was, I think you mentioned, done in South America. Is that correct?
Yes.
Whereabouts?
Colombia.
Colombia. That's great. A lot of doctors come from Colombia
Yes.
as well, and then Venezuela as well. Yeah, and other countries of South America. Yeah, I didn't know that. How many years ago are we talking? Were they working on this?
I think it was about, 4 years, they said?
Yeah.
Oh, this is
Studies.
moving fast.
The studies
About
have
5
been
years,
about
yeah.
4 to 5 years, yeah.
Do you know, was it created by like a doctor?
A
or
doctor. He was a doctor.
Oh,
Yeah.
he was a doctor?
Yeah,
Wow, there's been some great medical inventions in South America. So
yes.
kudos to that, and
Awesome.
and what you're doing as well. So we talked a little bit about also it's mostly taken from behind the ear, but there's other places too behind
Yes,
the
could
knee.
be taken anywhere
the leg?
where the doctor feels is a viable part of the skin. So if it's a podiatrist, they would take you from below the knee, maybe the back of the knee.
Okay.
And like we said, it's a small size of a pencil head eraser.
Yeah.
So it's a tiny piece.
And only 2 small vials of blood, so it's
Yeah.
fairly invasive. Yeah.
Yeah, it can be done probably,
Painless,
within
easy.
within the hour.
Oh, yes.
As
definitely.
opposed to
Okay.
the partial thickness skin graft that's standard care today, that has to be done in a surgery room.
Yeah. And that's tough. I actually
Patient
have
has to be on it, out.
yeah, my mom's going through that right now, and that's been tough. She had that, so I'm definitely gonna have her watch this show
Yeah, I mean,
and
it
talk to her
creates,
doctor.
yeah. Unfortunately,
create your own skin.
Yeah, to create your own skin is the best way.
wounds heal
Yeah.
a lot, take a lot slower to heal.
Yeah.
And we have doctors patients who have were suggested to get, amputations by 2 doctors, not just one. And then we used the amniotic fluid on them, and it healed within 30 days.
Wow, that's great
Yeah,
news.
completely.
And the problem with amputations, we've talked on this show many times, is the mortality rate over the next few years is very high.
Absolutely.
So it's just like you're not even out of the clear after the amputation, unfortunately. Let me give out the info again. My Own Skin, it's csqbio.com. That's csqbio.com. 844-583-0951. This is a local company that please support them, because this is great. This needs to get out to everyone who needs it. What are doctors saying about this?
The
so
doctors
far?
love it because one of the advantages that we have with the My Own Skin, it is a conjunctive therapy, as Momina mentioned. Not only do you have the My Own Skin, but you have the amniotic fluid. So you are increasing the patient's ability to improve their healing time, to get that wound closed with less scarring and less issues. So the doctors love it, the patients love it.
It helps with inflammation.
It helps with the
pain.
inflammation, it reduces
that's big.
pain, pulls down the
It
inflammation
also
from the
has
patient.
something for bacterial, microbial, in the
That's-
amniotic fluid, yes. So.
Yes.
Oh, I didn't know that.
Yes.
So yeah, that's
So
helping
it
to keep
prevents
the.
it from getting an infection. You wouldn't apply it to an infected area. You'd have to clear the area
Yes.
of infection. However, it does help with, it has an antimicrobial.
Yeah. Why do you think it's taken? Not that it's taken this long, but you've seemed to move this through pretty quickly. But this has obviously been years and years in the work by a lot of hardworking people. But yeah, why do you think it hasn't been invented before or used before?
Well, I think there again, traditionally they've used other skin replacements, and this is just some doctor improving the technology and bringing forth a better product.
And patient care and patient outcomes. And, the most important person here is the patient.
Definitely.
Yes.
We want to get them
Their
better.
quality of life.
Yeah, I was
It's
just going to
their
say better
bodies.
quality of life. We talk a lot about on that here because that can help you, live longer and healthier.
Absolutely.
And happier.
Happier, the happier you are.
Yes.
We know that's definitely key to health.
Absolutely.
The happier people can,
And it affects
stay.
everyone too.
Yeah.
Sons, daughters, extended family, family members, healthcare. It helps everyone.
That's great. Again, it's on csqbio.com. It's My Own Skin. It's just like it sounds. They take the skin, very small piece of skin. You said sometimes the size as small as a pencil eraser.
That's all it is the size of the pencil.
Unbelievable.
Yeah.
And again, too, we've had questions from patients because they're concerned with when you think about skin discoloration. In this case, it's your own skin, so it's going to be a much more perfect match.
Definitely.
In terms of, again, from a biological standpoint as well as, from a cosmetic standpoint. So if I'm a patient, whose skin would I rather have?
Yeah.
Someone else's or my own?
The doctors are able to use it just as they would use a regular partial thickness skin graft, meaning they could suture it, they could, it has very strong tensile strength. It could be cut, it could be sutured, it could be glued.
That's great. I think we only have time for maybe one more question. I was gonna. I jumped over this. How is it grown in the studio in the laboratory? How does it grown so fast?
No, actually, that's a proprietary.
Chinese.
Saved it for the last, and there's the music just in time.
Yeah, that's a proprietary
definitely.
purpose there.
We'll
Great question.
let's have you on again in the future and
Please.
get updates, and love to have some doctors in here as well. We can definitely do that if
Absolutely.
you're interested.
And I'll also reach out to our lab to check on the when you mentioned about the tattoos, because that's a
Yeah.
good question. We want to know. We're
I
unaware.
figured
but
scars,
yeah.
maybe tattoos
Absolutely.
Yes,
too.
because a lot of people, they really want to get rid of those
Yeah.
tattoos.
Well, thanks for driving up, and I appreciate My Own Skin. csqbio.com, 844-583-0951. And see you next time on the Living
Thank
a
you,
Longer
David.
and
We
Healthier Life
Thank you,
Show.
appreciate
David.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.